All right, everybody. Happy afternoon. Thank you so much for joining me here. I'm excited that you are here, and I'm excited to share with you a little bit about ozone therapy. Ozone therapy is something that I've been doing for more than 5 years at Valley Vital Medicine, and it is a huge part of what we do here. And frankly, it has done a lot of great things for myself, for my health, for my family's health, but also for many, many of our clients here. So I'm excited to share a little bit more specifically about what exactly ozone is and how we utilize it here in the clinic, and then also some of the potential uses that you can do with ozone therapy at home. I'm going to do a different presentation another day that covers a little bit more about ozone use at home. But excited to be able to be here to chat with you a little bit more about specifically what ozone therapy is, how we use it, and how it could potentially be of a real benefit. So thank you for being here. I'm guessing you're here because ozone therapy must have caught a little bit of a trigger as far as an interest for you and saying, well, maybe this is something I'm not quite sure what it is, or potentially I've heard of this, I need to know a little bit more, or perhaps maybe you've done a little bit of research already and you just want to know a little bit more about how we at Valley Vital Medicine incorporate it and how we use that technology in our practice. So happy to answer that, and hopefully we'll address all of those things for you here today. So whether you're struggling with fatigue, chronic infection, Lyme disease, mold illness, autoimmune issues, cancer, or you are just looking to optimize and improve your wellness, we're going to talk about those types of things today. And so hopefully there will be something in here that applies to pretty much everybody. Maybe you've tried conventional treatments and you haven't had a lot of success, or maybe you're looking for a way to stay ahead of disease and proactively optimize your health. That is exactly what ozone therapy is all about. So I'm excited that there is a natural, scientifically backed way to help to supercharge our body's ability to heal. It's a treatment that's been around for many, many decades now. It's been used by top doctors worldwide, and it's available right here in Fargo. And that's exactly what we're talking about today, specifically medical ozone therapy. And so let's go ahead and get started. So the information provided in this webinar is for educational informational purposes only and is not intended as medical advice. The content shared is not a substitute for professional medical care. I encourage you to always seek advice of a qualified medical provider with any questions you may have regarding a medical condition or treatment options that are right or specific for you. All right, got that out of the way. So, are you in the right place? So if you struggle with any of these, or perhaps these are priorities for you, you're in the right place, because we're going to talk about how ozone therapy can help to optimize and improve these conditions: fatigue and brain fog, heart disease, circulation issues, mold toxicity, Lyme disease, autoimmune issues, people who are looking to proactively improve their health, or perhaps you want to know what to do in the case of acute sickness. These are all really, really great uses of ozone therapy, and ozone has been changing lives for people just like you. But it's not just for those people who are sick. So it's been utilized by Olympic athletes, biohackers, other professional athletes, other health conscious individuals worldwide as well. And ozone therapy can help keep people in peak condition as well. So this is a picture of me when I first went to do my education on ozone therapy, and I was down in Reno, Nevada, learning from Dr. Frank Schellenberger, who is considered to be the godfather of ozone here in the United States. He traveled over to Germany to learn all about ozone therapy, brought it back to the US, and has really been doing a lot as far as furthering ozone therapy here in the US. But so you might be wondering, why should you listen to us? Why is it that you have the right to be able to tell me a little bit more about ozone therapy and the benefits of it? And I would tell you, so we are the most experienced and comprehensive ozone therapy providers in the area. I was the first one in the Red River Valley area to start offering ozone therapy about 5 years ago, and was trained by the American Association of Ozone Therapy at that time. We are also the only provider of EBOO therapy in the area. I don't have a full number of how many therapies we've completed in the last 5 years, but it's a lot. And we do major auto hemotherapy, high dose ozone, EBOO, and then we also do ozone therapy through other mechanisms as well, whether it's rectal insufflations, ear insufflations, um, sinus insufflations for acute illness, and some of that kind of stuff. But today, primarily, we're going to be talking about IV use of ozone therapy. We also combine UBI, and this might be something that we have a little bit more of a conversation about on another day as well. But UBI stands for ultraviolet blood irradiation. And the benefits to ultraviolet blood irradiation is that it's very synergistic to ozone, does a lot of the same things, and actually helps to reduce any potential negative effects that some people might experience with detoxification. This is our team at Valley Vital Medicine. It's a little bit of an older picture from last summer. Our team has changed a little bit. We've had a couple of additions, and we've had one of our teammates has left, unfortunately, but she's moved on to another opportunity for her career. But this is our team, and I always want to make sure that I give them a lot of kudos and props for the things that we do. Without them, we would not be as successful as we are in helping the clients that we are. They're amazing people. It's a great team, and if you've been here before, you know how amazing they are. In addition to this, I would just like to tell you just a little bit about who I am. I didn't get a chance to add a picture here of my family, but I'm married. My wife, Amy, is an amazing woman. She keeps everything in line for us at home and keeps me on the straight and narrow. And we have 3 kiddos, and we've got a little dog too. And so it really, really blessed with what God has provided us. So I always want to make sure that I say thank you to them for allowing me to be able to do what I do as well. Because as you may well know, if your family is not on the same page, or they're not supporting you in what you're doing, it makes everything so much harder. So just so grateful for what we have. So how did I discover ozone therapy? How did I get started with this? This actually began as I started Valley Vital Medicine here about 6 years ago. There was another nurse practitioner that I knew who was actually a friend of mine back in nursing school, and she was a year or so ahead of me. And her name's Jen Ursua, and she's a nurse practitioner out in Idaho. And I chatted with her a little bit as I was kind of getting started, because she started a practice similar to mine. And as she was getting started with, as I was getting started with my practice, I was just in touch with her, and I just said, hey, you know what? What is one of the things that you are doing in your practice that you feel like has just been a real game changer? It was worth adding to your practice. And she mentioned ozone therapy to me. And at that point, I was really familiar with a lot of things in the functional medicine space, learning a lot about supplements, about certain testing, things that we can do to help the body to heal naturally. However, I hadn't heard of ozone therapy. So I said, well, what in the world is ozone therapy? Because I haven't heard about this yet. And she kind of explained it to me a little bit, and I'll explain more in just a minute here about what ozone therapy is. But I said, what is it that has you really feeling like this was something worth adding to your practice? And she would give me specific stories about how people's pain was going away that hadn't gone away before, whether it's plantar fasciitis or knee or shoulder pain from an injection that she did, or just overall improved immune balance, immune function from people who have done the blood therapies with ozone. And I said, wow, that's really impressive, really amazing. So I said, thanks for sharing. I'll look a little bit more at that. I did a little bit of research, and I called her back a couple of months later, and I said, tell me a little bit more about this. And are you still sold on this? Do you think that this is something that's still been valuable and worthwhile to bring into your practice? And she said, yes, absolutely. And I said, well, what training, what education did you do? And so she turned me on to Dr. Frank Schellenberger and the trainings that he does. And that's ultimately what I ended up going forward with and doing my training. And once I started digging into the research, I found out that ozone's been around for over 100 years. This is not something that's new. It's been studied in top medical journals. It's been used to treat infected wounds. And now as people are continuing to utilize it for more and more conditions, that we're finding that it improves oxygen delivery, improves the immune system, reduces inflammation, and even improves circulation in heart disease patients. And so as I started looking at this stuff, I said, you know what, this is something worth pursuing. This is something I need to know a little bit more about. So that's kind of how I got started with ozone therapy and learning more about it. So I guess a really important question that we need to talk about is, what is ozone? Ozone is O3, okay? We pretty much all know oxygen's O2, right? So two oxygen molecules together, or two oxygen molecules together makes what we normally consider oxygen. However, when we take a third oxygen molecule and attach it to the O2, that is ozone. And it is made in a medical grade ozone generator, which we have a couple of those here in the office. And we use pure medical grade oxygen that runs through the ozone generator. And what the ozone generator does is it creates some electricity, which comes across the oxygen, and it causes some of the O2 to break up into O1, which then attach to the other O2 molecules to create a very specific ratio of O2 to O3 and a concentration of ozone that we can use medically for different conditions. And so what we do is we utilize different concentrations of ozone for different conditions. And so that's something that we as medical providers use to make sure that we're treating you in a safe and an effective way. So that's what ozone actually is. So let's talk about the history of ozone a little bit here. So ozone was developed or discovered in 1785 by a Dutch physicist, Martinus van Marum, by perceiving a particular odor. And if you've ever smelled ozone before, it smells kind of like the smell that you smell after a rain, where things smell kind of a little bit fresh. But if you're in a more highly concentrated ozone, it's a little bit stronger than that for sure. But he noticed that smell, and that smell was generated near electrostatic machines, because what that was doing is it was breaking up those oxygen molecules, and O3 was being developed. So the discovery then crossed the ocean to North America in 1885. And I'm skipping through some of the history here because we could do an entire hour-long class on the history of ozone. But it came to North America in 1885, and the Florida Medical Association published its first textbook, actually, on the medical applications of ozone, written by Dr. Kenworth. In Nikolai Tesla, many of you are probably familiar, recognize that name. He actually patented the first ozone generator in 1896, and in 1900 founded the Nikolai Tesla Ozone Company, where they were manufacturers of generators for medical use. In 1911, Dr. Noble Eberhardt, which was the head of the Department of Physiology of Loyola College, Chicago University, in the Manual of High Frequency Operation, states that he used ozone to treat tuberculosis, anemia, chlorosis, which is an iron deficiency anemia, tinnitus, whooping cough, asthma, bronchitis, hay fever, insomnia, pneumonia, diabetes, gout, and syphilis. So you can see a wide range of indications that he was using this over 100 years ago, and actually about 115 years ago, where he also created the first university teaching center dedicated, among other things, to ozone therapy. So this goes back quite a ways. In 1915, Dr. Wolf, who was the chief surgeon of the medical services of the German army, extended the use for topical treatment of ozone to infected wounds, frozen foot, gangrene, and decubitus ulcers, which came about from the World Wars. In 1961, Dr. Hans Wolff developed the major and minor auto hemotherapy techniques, which are used today and are really the standard of modern ozone therapy. I'll explain that to you in just a little bit. In the 1980s, Renee Wiebon Hansler wrote the classic text, The Medical Use of Ozone, in which she described the innumerable local and systemic applications of ozone therapy. In 2010, the International Scientific Committee on Ozone wrote the Madrid Declaration, which serves as the current standard for ozone therapy. The Madrid Declaration was revised in 2015 and contains references and instructions for every kind of ozone application currently used in the scientific ozone community. So there is a true standard by which we go by when we are doing ozone therapy. So this has a long-standing history. It has been well researched, and we'll talk about the research in just a little bit. And many therapies of ozone therapy have been done through the decades, through the last over 100 years. And now it's gaining a lot of popularity. And I'm sure there's many thousands of ozone therapies that are being completed on a daily basis across the US and around the world. So ozone therapy works. Some of the things that it works for: coronary artery disease, claudication. So claudication is a decrease in blood flow to the lower extremities. So, excuse me, if somebody is walking and they, after a certain period of time when they're walking, they start to develop increased pain in their legs because they're not getting enough blood flow, there's not enough oxygen. That's what claudication is. And so we can see a real improvement in that with ozone therapy. Gangrene or infection, chronic infections. I think a lot about diabetic ulcers and wounds. Pain is a great treatment with ozone. Macular degeneration, aging and wellness, just a great way to stay healthy. Oncology, chronic viral infections, acute illness, as well as mold toxicity are some of the main indications for what this is used for. But how does it work? Well, first, let's talk a little bit about why it works. So what ozone therapy does is it supercharges your body's ability to heal itself. Let me ask you a question, and I guess I'm kind of giving it away by putting this slide up here already for you, but what is your most critical nutrient? If you think about it, a lot of people would have a tendency to say, well, maybe B12 or vitamin D or vitamin C or something along those lines. What I would propose to you is that oxygen is actually your most critical nutrient. And without oxygen, you don't live very long, right? Without some of those other nutrients that I just mentioned, you could live for a long time without those things, hours, days, weeks. But without oxygen, you don't live for more than a few seconds or minutes. And so ozone itself actually increases oxygen delivery to your tissues. And by doing so, it promotes mitochondrial health, it stimulates cellular repair and detoxification. It boosts the immune system to fight infections. It reduces chronic inflammation, which ultimately, chronic inflammation is the root cause of most disease. Okay. Now, there's a lot of things that cause that inflammation, right? But ozone actually helps to directly reduce that inflammation. How does it do this? It creates ozonides as a byproduct, which again, we'll talk a little bit more about that in a couple slides here. But this is why so many people, whether they're battling a health condition acutely or chronically, or anybody who just wants to optimize and improve their health in the short term or in the long term, will utilize ozone therapy to experience the life-changing results. And we see this every day here in the clinic. So, as I mentioned, oxygen is our most crucial nutrient. So I want you to think about that for a minute. How do you breathe? How do you get oxygen into your tissues? But what I would propose to you is that it's not just about how much oxygen you get into your body, It's about how much of that oxygen are you actually able to use. Now, we all have those little oxygen probes that we can put on our finger, and that tells us what the oxygen percent in our blood is, which is important, right? We don't want that to be too low, and that should be ideally 95, 97 or more, 97% or more on room air. However, just because that oxygen is going through our blood does not mean that our body's using it. And it's about our body's ability to take and utilize oxygen. And so, what are some signs that potentially you are breathing in oxygen, but you're not utilizing that oxygen well? And so, here's a little list of symptoms, and maybe you can relate or you know somebody who can relate to these symptoms. Shortness of breath with exertion, exercise intolerance. So, in other words, you don't exercise very well for very long, you get really tired really fast. You're sensitive to the cold, you have a low body temperature, you feel like you're weak, tired, or you have generalized pain. These are symptoms of decreased oxygen utilization and signs that we need to go about trying to figure out how to improve your oxygen utilization. And ozone therapy, again, is just one piece of the puzzle. So what does it mean when we have low oxygen utilization? So essentially, your tissues then don't have enough oxygen. And so what are the consequences of that? Well, you will generate more free radicals. So free radicals are think about kind of that rusting on your cells, inflammation. So you develop more inflammation, more rusting in your cells if you don't have enough oxygen. It deprives cells of vital functions, including repair mechanisms, membrane polarization, enzyme synthesis. This includes the synthesis of antioxidant enzymes. So again, if you have that rusting in your cells, you're feeling slow, feeling sluggish, you have more oxidative stress in your body, it's important to be able to develop those antioxidant enzymes. And if you don't have enough oxygen, you can't even do that. And ultimately, this destroys your mitochondria. So mitochondria, if you're not sure what that is, I encourage you to do a little bit of research. But it's kind of the battery packs in your cells. It is the cellular charged particles that help to keep your body up and rolling and moving. And so if we don't have enough oxygen in our cells, the mitochondria die due to no oxygen utilization. So this low oxygen utilization is the metabolic equivalent of hypoxia. So in other words, you are not able to have an optimally functioning metabolism either. So what causes mitochondrial toxicity, which ultimately is the same as decreased oxygen utilization, or some of the causes of decreased oxygen utilization? So medications can play a really significant role there. Toxins. What do we mean by toxins? So toxins, I think about things like mold, think about heavy metals. I think about other environmental toxins such as herbicides and pesticides, things like glyphosate, which is Roundup. Also, I think about food that is not real food, something like Frankenfoods that are made and put in a box with a label that has a ton of ingredients on it. Other toxins that I think about are excessive stress, and potentially relationships that can be toxic as well. And these are all things that can cause decreased oxygen utilization in your tissues. Just getting older causes mitochondrial toxicity. Trauma, physical or emotional. Infections. So I'm a firm believer that we all have a parasite load of some sort. So it's a matter of what is the balance of those parasites in regard to the rest of our immune system. But also, we think about chronic infections with viruses, Lyme disease, maybe potentially imbalanced bacteria or bacterial infections in our gut or other places throughout the body, and nutrient deficiencies. So I will tell you that if you have not had a really thorough lab test done to look at your nutrient levels, that's something that pretty much everybody I would say everybody should do, especially once they start getting into their 30s, 40s, and later. So that way we can help make sure that you are optimizing your health and that you have the things that you need to be able to stay healthy. Because if your cells don't have what they need in regard to the nutrients to be able to function right, they're going to start breaking down and further cause more of that oxygen deprivation. Now, I do want to be clear that ozone is not a standalone therapy. So in other words, it's not a magic bullet. It's not going to fix anything on its own, with maybe a couple of exceptions with acute illnesses and some of those kinds of things. But especially when it comes to chronic illness, we need to keep all of these other things in mind. Diet and nutrient optimization. Make sure that we're eating a really clean diet. Make sure that we're eating things that God gave us. If we can pick it off the ground, if we can take it off of a tree, if we can shoot it and kill it, like those are the types of things that we should be eating every day, and not things that come in a box with 500 ingredients on them. Detoxification is really, really important. I would say that hormone replacement therapy, especially as people are getting older, is really, really crucial. We need to make sure that our cortisol is balanced, that our thyroid is optimized, that our testosterone, estrogen, and progesterone is where it's supposed to be, so that way you can help to maintain a well-functioning system. We need to eliminate the cause of toxicity or potentially infection, and make sure that we're going through a process to address those things. We need to optimize our stress. Many of us live in an incredibly stressful environment on a day-to-day, whether that is spending too much time on our screens, whether that is relationships that are incredibly stressful, whether it's a job that's really, really stressful, or we're not sleeping. Those things need to be taken care of as well, because that is a really, really important thing as you continue to work on healing. And then ozone therapy is an additional part of this treatment plan as well. Now, what about contraindications? What are some of the reasons that maybe this would not be a really good fit for somebody? So G6PD deficiency. So G6PD, what it is, and we do this as a baseline test for everybody that comes into our practice so that we've got it on file. It's a one-time lab test that we do. And what we're doing is we're testing for a genetic abnormality where you have a deficiency in G6PD. This is more common in like Mid-Eastern type people that have a heritage from the Middle East. Jewish descent may see more of a G6PD deficiency. So what does it mean if you have that? What it means is you're at a higher risk for hemolysis or bursting of your blood cells if you are exposed to an oxidative stress. So ozone therapy is technically an oxidative stress, and so are things like high-dose vitamin C and some of the other things that we do. So what does it mean? So what would that mean to you? Well, that would mean that you would have a risk for anemia because your blood cells are bursting if you have significant oxidative stress and we use ozone therapy with you. So we want to make sure that that's not a concern. It's really, really rare. We've done a lot of this testing. I've never had one come back to be positive, but we do it as a just doing our due diligence to make sure that the therapies and the things that we're doing are safe for you. Uncontrolled hyperthyroidism, so a Graves' disease that isn't controlled, would be considered a contraindication. An active seizure, so we don't want to, if somebody's having a seizure, they're laying on the ground having a seizure, we don't want to hook up and start giving them ozone therapy. cardiovascular instability. While ozone's actually really great for the heart and great for the vascular system, if somebody's actively having a heart attack or they're in the immediate phase of recovery from a heart attack, that's not the best time for us to be doing ozone therapy with them. Hemochromatosis are really, really high levels of iron, acute alcohol intoxication, acute heart attack or stroke, somebody that has really low platelets, and then somebody that's receiving treatment with iron or copper. The reason for that is if we oxidize those metals, that can cause some extra inflammation. So that's why we don't want to be giving ozone therapy along with those things. So what are some of the published effects of ozonides? So as I mentioned earlier, when the blood is exposed to ozone, it creates ozonides. So it's kind of the downstream metabolism of ozone. And so ozonides are ultimately what has the beneficial effect in our body. Before I get into this, let me explain this to you real quickly, that ozone therapy, or ozone itself, is a very unstable molecule. So as we said, it's O3. So as soon as we put it into the body or we expose our tissues to ozone, that ozone immediately dissipates. That extra oxygen molecule comes off of the O2 right away and super oxygenates the tissues, and the ozone's gone. And so that chemical reaction happens almost instantaneously when it's exposed to the body and to the tissues. And what's left behind are ozonides. And ozonides are what cause the effects on the body and stimulates the immune system, creating cytokines and some of these other things. So what are the published effects of ozonides? It's antibacterial, and it's selective to anaerobes. So what that means is organisms that don't use oxygen. Okay, it's antifungal, it's antiviral. So there is no resistance known to ozone. And so many of us have been prescribed antibiotics for infections in the past. And one of the potential risks with taking antibiotics is the fact that sometimes our cells become resistant, or the viruses or bacteria become resistant to the antibiotics. So one of the really cool effects of ozone, we can utilize this in illness and in infection. We don't have to worry about cells or viruses or bacteria becoming resistant to the therapy because it works every time. It enhances chemotherapy and radiation. It activates NRF2, which goes right alongside the bullet right below that, where it says it's improved antioxidant function. So NRF2 is one of your most potent antioxidant functions in the body. It increases nitric oxide, which improves oxygenation, relaxation of blood vessels. It's a metabolic stimulant, so it improves your metabolism, and it helps to modulate or improve your immune system function. So what does a modulator mean? So modulator means that if your immune system is functioning high, it'll help to balance and bring it low. If your immune system's low, it'll help to bring it up and just modulate it in the middle. That's what a modulator means. Okay. So we need to think biologically about ozone. It doesn't act as a drug. Okay, so if you think about drugs, pharmaceuticals that are given, they will exert a specific effect on a specific receptor, and that's all they do. That's their job. Ozone doesn't act like that. It's a biologic system stimulator. So when your body's exposed to it, it changes in response to that stimulation. So I get this question regularly from our clients when they're sometimes are a little bit nervous about starting ozone therapy. Is this safe? So let's take a look here at Major Auto Hemotherapy. And this is an article that was written, Accidents and Typical Complications in Ozone Therapy. And this was from a questionnaire that was sent out to 644 ozone therapists. There were 384,775 patients that were treated at an average of 14.5 treatments per patient. So what that means is there are over 5.5 million treatment sessions that were given. And they found that amongst those, they saw a complication rate of only 0.006%. This therapy, if done correctly and done safely in the way that it was taught to me, the complication rate is incredibly low. Okay, so aspirin has a higher complication rate than this. So again, what are some of the main applications? Coronary artery disease, gangrene, macular degeneration, aging and wellness, chronic fatigue, oncology, acute infection, chronic infection, allergies, autoimmune issues, ulcerative colitis and Crohn's, and preconditioning. What does preconditioning mean? What this means is we can utilize it to prepare somebody for a procedure that they're going to undergo, such as a surgery. So I do think that it's valuable and have seen benefits to clients who have utilized this either before a dental or other surgery. So let's look real quick here at some of what the research shows. There is a research group through the American Association of Ozone Therapy. And if you go to their website, aaot.us, you will find at the top that there's a button there where you can click on literature, and it will take you to this page where you can go in there and you can look at research articles that have been done and compiled on ozone therapy. There are currently over 4,300 research articles done on ozone therapy. So let's give you a couple of examples of what some of the research shows. And obviously, we don't have time to go through 4,300 research articles or even all of the different conditions. So I just wanted to give you a little bit of a sampling of what some of the research has been shown. So this one's titled The Effects of Oxygen Ozone Therapy on Age-Related Degenerative Retinal Maculopathy, or retinal degeneration is really what we're concerned about here. And so age-related degenerative maculopathy, okay? So this is people who are losing their sight. And so they did visual acuity and eye fluoroangiography. So in other words, they did a study that they were looking at how well the eye is functioning and utilizing and is able to see and able to utilize light. And they administered ozone through IV, through Major Auto Hemotherapy, and over a 4-month period of time. And so their results actually were pretty impressive. So like I said, they did Major Auto Hemotherapy once a week for 14 weeks. And what they found was after 1 month, so again, this is macular degeneration. There's 2 different types. There's dry and there's wet. And what they found is in the dry version, after 1 month, 44% of people actually saw improvement in their vision, which you normally wouldn't see. Only about 5.5% of people were worse, and 50% saw no change, which no change is actually a good thing in this particular scenario. And then in the wet version of macular degeneration, they saw 100% no change, which again is great. Now, visual acuity after a 4-month period of time, the dry version, they saw 38% had improvement. 5.5% were worse, and 55% saw no change after a period of 4 months. In the wet version, 13% were improved, 18% were worse, but 68% saw no change. So in other words, the vast majority of people who were treated with macular degeneration saw either no change or improvement, which is not a common thing to be seen in macular degeneration. So very encouraging with that. This one I found that I thought was pretty interesting, and this is about peripheral neuropathy after chemotherapy. And this was a research article that was done just a couple months ago, or published just a couple months ago. And patients with persistent numbness and tingling secondary to the chemotherapy-induced peripheral neuropathy showed clinically relevant and long-term improvements after ozone treatment. The magnitude and duration of the observed effects merit further research and support our ongoing clinical trials. So one thing you'll notice when you're reading pretty much any sort of medical article is they're going to say more research needs to be done, because nobody wants to make much of a final decision and say what we have found is the end all be all. They're always recommending more clinical trials, which I think is great, but at the same time we can take some real positive information away from this. Now, what about long COVID? And that's what this post-acute sequelae of COVID-19 means. And what they found, and this was back in 2020, so really unfortunate that this information didn't come out a long time ago, or at least become more well-known or more aware. But efficacy was greater in the ozone group than in the conventional treatment group, with interventional effectiveness. So they saw more than a 50% reduction in symptom scores after utilization of ozone therapy in people who were struggling with long COVID in this particular scenario. So as I said, there's many thousands of articles. If you have a particular concern or reason that you'd like to utilize ozone therapy, I encourage you to chat with me or somebody else here at the clinic, and we can do our very best to make sure that we're able to answer your questions. But also, you can go on to PubMed, or you can go on to the AAOT.us and start looking at some of the research yourself and see what some of the benefits are. Now, I will tell you, while things are supported by clinical research, sometimes we actually find things to be beneficial in the clinic more so than what we always see in the research. So point being is we definitely see improvement and scientific validity in the research in regard to utilization of ozone therapy. So how do we use ozone therapy here at Valley Vital Medicine? So one thing I want to be clear about is we do not do what is called direct IV ozone administration. And what some people will do for direct IV ozone administration is they will actually draw up into a syringe pure ozone gas. They'll put a needle on it, and they will put it directly into their vein and shoot ozone gas directly into their vein. Now, technically, you can do this if you have an incredibly pure ozone oxygen mixture, because ozone and oxygen will immediately get absorbed into the bloodstream. However, the potential complication comes in if there is some, how should we say this? If there's some air particles that got into your ozone mixture. And what would that mean? So that would mean there's other things like nitrogen and those types of things within the ozone sample. If that gets injected directly into the bloodstream, that is where we're going to have more potential for complications. And you can actually see things like a pulmonary embolism, which then would go to the lungs, and it would be a medical emergency. So the direct IV ozone is where the greatest risk is associated with doing ozone therapy. And so we don't do that. And what we do is we actually do the therapy as recommended by the American Associated Ozone Therapy. And what I was trained to do is we actually take and inject ozone directly into the blood up into an IV bag. So for major auto hemotherapy, what that means is we start an IV, and we hook up an IV bag with some tubing, and we draw out 60 cc's of blood, okay, or 60 milliliters of blood. And once about half of that saline is administered or infused, we put the blood up into the IV bag. Once the blood is up in the IV bag, we will treat that blood directly with ozone gas. And you can see in the screen here, I didn't get a real great picture here to be able to show you, but you should be familiar, I'm sure, with how dark your blood initially looks. And I've actually got a picture here in a couple screens that will kind of further show what some of the differences are. But that blood doesn't have a lot of oxygen in it. And so if you look at the bag here on the right, that has been treated with ozone, and you can kind of see how bright red and beautiful that blood is, because it's fully oxygenated, and it is having the full effects of the blood being treated with ozone, the oxygen. And then at that point, we give the blood back to you. And as we give it back to you, it goes through the ultraviolet light that we talked about at the beginning of the presentation. Now, we also have a procedure called a high dose ozone. And high dose, what that means is we start an IV, hook up the IV tubing, and we actually pull the blood up through the IV up into the IV bag. And the bag that we're showing you there is actually the high dose. And so with that high dose, we treat about 300 milliliters of blood, treat it with ozone, and then give it back to you through that ultraviolet light. Now, there's another form of ozone that we offer here called EBOO. And EBOO is currently the most advanced form of ozone therapy available. And that also incorporates the ultraviolet blood irradiation. But that involves actually starting 2 IVs on somebody. So the blood actually comes out one side, goes through a dialysis filter where it's continuously ozonated and oxygenated, goes through the ultraviolet light, and then back to the person on the other side. And it's a continuous therapy for about 50 minutes. Now, I will tell you, the Major Auto Hemotherapy is very effective on its own. What we'll do is we'll start at a lower dose or concentration of ozone, work our way up over a series of 5 to 8 therapies, depending on how sensitive somebody is. And so we're titrating up on our dose, and then we will transition into a high dose ozone. And from there, we will continue to titrate our way up until we're at about 68 gamma. And usually we start at about 17 gamma or so with our titration. So gamma is just the terminology that we use for the concentration of ozone. It is important that we give the body the ability to adjust to the concentration of ozone and not overstress our immune system with this therapy. So we want to be a little bit patient. We want to slowly work our way up until we get to a place where we want to be. So what I will tell you is high dose ozone is equivalent to each one is equivalent to about 10 of our major auto chemotherapies. Our EBOO would be equivalent to about 30 of our major auto chemotherapies in one session. So it's a much more effective and efficient way of doing it. We also have other ozone therapy here in the office that we utilize for different conditions. Prolozone or injections are just injections that I do around the body for pain. We have our Hockett sauna. We do ear insufflations and rectal insufflations for other conditions as well. And so we'll talk about that during a different presentation, but we do have those different options available. How do you prepare yourself for ozone therapy? It's important that you're well hydrated. It's important that you eat well before your therapy. We want you to eat a clean diet and have some good protein. One of the most common reactions that potentially we could see, is our vasovagal reaction. So in other words, somebody gets lightheaded, doesn't feel well because they got a blood draw, they got a poke, and some people just struggle a little bit more with that. And so it's important that we're well hydrated, we've eaten well. That really reduces the risk of seeing that. Now, one thing to keep in mind is that it would be good to avoid vitamins and minerals before your therapy and take them afterwards. Reason for that is because of some of the antioxidant effect that those things have. We want to allow your body to react fully to the oxidant therapy. Now you say, wait a minute, you're talking about how important antioxidants are. Now you're telling me that you're going to give me an oxidant. Yes, that's right. The reason is, if you think about exercise, what do? You stress your muscles when you're exercising. And so when you stress your muscles, they break down a little bit before they are able to regenerate and to heal. Ozone therapy does the same thing with your immune system. Okay. It stresses your immune system a little bit, but then what that encourages your body to do is to heal and repair the immune system so it actually gets stronger and has better balance. So that's kind of how, that's more so how ozone therapy works. And you can actually utilize antioxidants after your ozone therapy. And in fact, oftentimes we'll even do things like give vitamin C by IV after ozone. So the process, we talked about it a little bit already. Here's a couple of pictures of me doing EBOO. So you can see in that bottom picture there, the difference in the coloration of blood that's coming out that is directly out of the vein versus the blood that is going back that has been ozonated and oxygenated, and how much of a change there is there. It's something that's really, really cool, and I never get sick of seeing it. But you're getting good stuff back when you see that coming back in. So this picture on top, that is our EBOO device. And you can see the blood coming out one side, going through that pump, going through that dialysis filter, through that ultraviolet light, and then back on the other side. And in this case, in this scenario right here, this is a picture from me doing this here just a couple of months ago, after I had another recent COVID infection. And I didn't test or anything, but certainly had the symptoms that I just knew that's what was going on. And I was really, I had recovered mostly. I had done some additional high dose ozone as well as high dose vitamin C therapy to help get me over the hump, get myself feeling better. However, I still just had this fatigue and brain fog going on. And as I said, this therapy is about a 50-minute long therapy. When I was about 20, 30 minutes into this, my brain fog went away and didn't have any more issues with it after that. So definitely saw some real benefits with it. And so this is a picture of me doing that, like I say, a couple months ago. So how many therapies do you actually need if you're gonna utilize ozone? So I would say that this is individual, and it depends on your concerns, your level of ozone that you would like to utilize. And we talk about that as a part of your consultation, talk about it as your part of your plan. And I make some specific recommendations to you as far as, how resilient are you? How well do you handle therapies? Should we start with a major auto hemotherapy? Are you able to go right to EBOO? And that answer is a little bit different for everybody. If you're going to do major auto hemotherapy, high dose ozone, I encourage people to plan on doing 10 therapies, and those optimally would be done at a frequency once to twice a week, and then reassess where you're at. Now, the ozone therapies, what I had mentioned before, and in some of those research articles that had been done, some of those people had normally were receiving 14, 15 or more therapies in those research articles. No, I do like to kind of explain the difference between MAH and high dose ozone therapy and EBOO a little bit more. And the fact that MAH and high dose ozone act more like jumper cables. So they are a quick hitter of a little bit higher concentration of ozone, really give your body kind of that jump start to kind of get your body rolling again. I consider EBOO to be more of that trickle charger. So if you think about, okay, I was able to get my car jump started today, but then I was able to get it home. And by the time I got home, my battery was kind of wearing out again already. Now you're going to have a better chance of keeping your battery healthier longer and holding a better charge if you put it on a trickle charger overnight. Okay, does that make sense? So EBOO is kind of more like that, where it's going to have a more, it's going to be a slower response, but it's going to be more powerful over the long run. And generally with EBOO, what I'm looking for is to do about 3 therapies for the vast majority of people, ideally done about a week apart from each other, and then reassess. Some people, depending on their conditions, what they have going on, say, you know what, we can spread that out. We can do once a month. So again, it does vary and depend on what your health concerns and what your health goals are. Now, doing a one series of therapies for ozone once and just calling it quits and being done is not optimal. It may help you in the short term and help you to get over an acute health challenge. However, to maintain the benefit, it is really important to consider continuing to do ozone therapy at least once a month for maintenance. Because if you think about it, we continue to live our life. And as we live our life, we're exposed to additional stresses, we're exposed to additional toxins, we get older, our cells continue to get worse and degenerate. So by continuing to maintain the benefits of staying on top of your ozone therapy at a minimum once a month, that's going to allow your body the best opportunity to continue to maintain those benefits. So I encourage you to continue to remember that is the best or the optimal. Can you use it in the short term without doing maintenance? You can, but ultimately in the long term, you're not going to continue to maintain those benefits. So let's talk a little bit about some of the results that we've seen in our office. And so, as I mentioned earlier, this is one of the therapies that I really love. It's something that we do a lot of. We do ozone therapy every day. So this is not something that we do once in a while and I barely see, or that we, almost never have anybody in the office doing. So I've actually had clients who have been sitting in the chair receiving their ozone that saw improvements in their visual acuity just right while they're sitting in their chair. Doesn't happen very often, but we've seen it, right? And so when you start to see these things, you know how powerful that the therapy is. We've seen people with chronic pain see significant improvements in their pain, their aches, and their achiness and their pain in their joints. We've seen improved energy, improved sleep. We do a lot of ozone for acute illness. So anybody who has an acute bacterial or viral illness that calls the office, my optimum for the majority of those people, and again, we would do an assessment for you and make sure that this is right for you, but we would have those people come in a lot of times and they would do an ozone therapy immediately followed by a vitamin C IV. And we've seen 24-hour improvements for kids who have a post-viral issue as far as significant aches and pains in their muscles to the point where they can't hardly walk. And the next day they're doing much better and able to walk and be almost normal. And we've also had an individual, more than one individual, who came in with quote unquote walking pneumonia, who was told that they needed to be on antibiotics and didn't want to take them. I said, well, come in, we'll do an ozone therapy. We followed with a 100-gram dose of vitamin C. And the next day, they were 95% better. We've seen significant improvements in lowering mold toxicity for people who are struggling with that. Another really interesting one is because of the improvement in metabolism and utilization of glucose by doing ozone therapy, we've actually seen improved blood sugars in diabetics as well. So that's really been encouraging to see. So how to get started? So for our current clients, people who are currently patients of Valley Vitamedicine, you can always set up a 30-minute consultation with me, get in, we can talk about this a little bit more, or perhaps you've already been recommended ozone therapy. If so, give the office a call, we can get you on the schedule. If you're not currently a client of Valley Vitamedicine, you can register for a free discovery call where we talk through what your health concerns are, what your goals are, and if we're a good fit to work together and how we can be of help to you. And so at the bottom there, you can see our website to register for a free discovery call. We sit down during your consultation. We talk about the different types of ozone therapy, what's right for you. Do we need to, or do we want to combine it with other IV therapies that we have, or perhaps the Hocket, or, maybe we need to talk about other labs that we need to do, dietary changes that we need to make, and also, any other supplement, potentially medications, or other therapies that we need to utilize to help to get your life, to help get your health turned around. And ozone therapy can certainly play a significant role in that. And then after that, of course, we need to see how you respond. And so one of the things that we are really good at here in our office is paying attention to to all of our clients and getting their feedback on how things are going. And if your body's giving us signals that we need to slow down, or perhaps you're tolerating things really well, maybe we need to, we can make some adjustments on your therapy and make sure that we're continuing with a frequency and also a titration and strength of therapy that's right for you. So if you have questions, please, if you're a current client, send us a message in the portal, or if you're interested in getting started with us, you can register for your free discovery call right there. I would like to know what kind of questions you have. So as I mentioned earlier, I realized that our I realized that our chat is not really working very well in this webinar today. So if you would, at the bottom of your screen, there's a place down there where you can raise your hand. And if you would like to raise your hand and ask a question, I can definitely, you can unmute yourself. You can ask me a question, and I would love to answer any questions that you have at this point. So please feel free to do that. And I'd love to know what questions you have. So I'll give you guys just a minute. Please feel free to raise your hand or just unmute yourself, and we'll answer your questions here. Crystal, I see you there. Do you want to unmute yourself?
Yep, I was just wondering if the sauna, the whole cut sauna, is FSA eligible, or like the packages are FSA eligible.
Yes, the therapies that we have here in our office, we can use FSA and HSA funds for. Yes, absolutely, 100%.
Okay, thank you.
Thank you. Deb, I see you have a question.
Hi, can you hear me?
I can, yes.
Okay, great. Yes, I've talked to you once before, but I've been diagnosed with functional dyspepsia, chronic pain in the upper GI tract. And I guess someone told me that my body is always producing too much IgE versus it should be producing more IgA as part of the immune system. That there could be inflammation, not just in the stomach, but in the duodenum. And I'm wondering if ozone therapy would, if you've seen any help with functional dyspepsia, because it's very hard to treat.
It is hard to treat. Would it make a significant difference right away as far as the symptoms that you're having? I haven't utilized ozone therapy directly for that indication. Now, would it help with your full body inflammation? Yes. Would it help to balance the immune system? Yes, it would help with that as well. However, as far as the acid reflux and those kinds of things that come with functional dyspepsia and those types of things, that would be something that we would certainly need to look at other indications or potentially therapies for. And sometimes there's medications that are causing issues with like calcium channel blockers and some of those kinds of things that are preventing the esophageal sphincter from being able to close, and some of those kinds of things. So I guess that would be just a conversation that maybe we would need to have a little bit more in depth.
I don't have acid reflux at all. It's just
okay.
Chronic pain.
Mm-hmm.
They one day might be not too bad, the next day severe pain. I'm thinking you also do peptide therapy because this could this be utilized in conjunction with BPC 157 and KPV? I've heard about that.
Yeah, absolutely. Those would be really great considerations as far as really potent anti-inflammatories. TB4 or TB500 would be additional options of considerations for peptide therapy as well. Another really potent anti-inflammatory that I think would be worth considering would be we actually have started doing CBD IVs in our office now as well. Which can help a lot with pain as well.
Okay. And one other quick question. I also have eustachian tube dysfunction, which has lately been giving me vertigo to have a blocked eustachian tube and tinnitus. Would ear insufflation help with that?
It would certainly be worth a trial to see how you responded to it. One of the things that I love about ozone therapy and the other things that we do is the fact that these therapies do not they don't cause any harm, and they have a real significant potential for benefit. And so I would that's one of that would be one of the most biggest benefits of trialing ozone therapy, especially with like an ear insufflation or something along those lines, is there's no risk of harming anything, and certainly the potential for benefit is significant. So I would certainly say that would be worth a trial.
Oh, okay. It doesn't actually open up the eustachian tube at all then.
Well, it potentially could, especially as it improves oxygenation. It can address any potential bacterial imbalances that might be in the ear. Anybody who's dealing with that concern too, I encourage a chiropractic evaluation to see, if there's something that the chiropractors can do to open up some of those eustachian tubes too.
Okay, great.
All right. Thanks, Deb.
Hey, thank you.
Adriana, do you have a question for me?
Yeah, just a quick question. I know I thought you said something about like iron and copper if you're supplementing with those. You don't want to do ozone therapy, is that correct? Or do you just want to come off that supplementation for a couple days while you're doing the ozone therapy, or?
Yeah, that's going to be individualized a little bit depending on the person. So it would, as I mentioned earlier, it'd be best not to take supplements anyway right before you come in and do ozone therapy. So encourage people to keep that in mind. Now, somebody who's going and doing iron infusions, that would be something for us to consider. Are your iron levels now higher maybe than what they should be? Or potentially we need to just be really cognizant of not doing the ozone infusions right next to where an iron infusion would have been. If we are taking some iron for low iron or copper for low copper, I think that's not a problem. Again, I would just not want to use them necessarily, within a really short period or time frame of each other. The concern with it is, are we oxidizing some of those metals and causing more inflammation that way? That would be the biggest concern. But again, it would just be something we would just need to just not utilize it right exactly at the same time.
Okay. I have one other quick question.
Sure.
Do you have time? I don't know.
Of course. Absolutely.
The ear insufflation how do you say it?
Insufflation. Uh-huh.
Yeah, what determines whether you would go with that route or like EBOO or
Yeah, so the ear insufflation, what that looks like is it looks more like a stethoscope, and the pieces go into your ear, and it's a tubing that's hooked up directly to the ozone generator, and the ozone gas is directly infused into the ear canals. So people that are a better fit for doing like the ear insufflations, are people that are going to be struggling with like an acute ear infection, or perhaps like a middle ear infection, or like the ear canal is infected. Something along those lines would be more, or you could even try with a tinnitus, something along those lines. Those would be the people that I would consider utilizing like an ear insufflation for. People that have more of a systemic concern, that's more where I would have a tendency to have the conversation around, okay, do we want to do a major auto hemotherapy? Do we want to do EBOO? You know, and some of the determination of what we do depends on the individual person, how sensitive they are, and then also, you know, some of it comes down to what people want to invest in as well.
Okay. All right. Sounds good.
So it's a conversation to be had so that we can, you know, make that conversation together, or make that
Yeah.
decision together.
All right. Thank you.
Thank you. Any other questions for me as we wrap up today? Deb, you have another question? Did you have anything for me there, Deb? I see your hand is up again. Okay. Well, thank you so much for everybody for
Hello?
being. Yeah, go ahead, Deb.
Oh, hello. My iPad froze.
Sure.
Let's say you also have some mold colonies in your body, and you're going to treat your stomach or your ear or whatever. How does it affect the mold? Does it bring it out of your tissue and cause some sort of a Herx reaction, or what can we expect with that?
So ozone's a really great addition into for people who are undergoing mold detoxification. Generally, I have those people on a pretty comprehensive detoxification process, and then we utilize ozone alongside of it. I like utilizing different binders for people who are who have mold as well. Like a biotoxin binder, one from Cellcore is one that I really like, and I get good results with. Um, so, you know, as far as a Herxheimer reaction, that's why we start with really a lower dose of lower concentration of ozone, and we titrate our way up depending on how people respond. We do find that sometimes people are more sensitive than others, and if they are more sensitive, then we can lower the dose even from there. EBOO, we have the ability to do what we call our half EBOO session, where we actually do about 25 minutes of therapy instead of the full 50 minutes for people who are a little bit more sensitive that way too. So we definitely do tailor the therapies directly towards people as far as what their body can handle. Yeah, it definitely helps with detoxification with mold symptoms for sure.
Mm-hmm. No, that sounds great.
Okay. Thanks, Deb. All right. Well, thank you so much, everybody, for being here. I greatly appreciate it. I'll give you a couple more seconds here to be able to ask a question if you have one. Otherwise, I encourage you, you can send us an email. You can email me directly, trevor@valleyvitalmedicine.com. I see here on my slide that you can't see the full the full email address, unfortunately. So frontdesk@valleyvitalmedicine.com or trevor@valleyvitalmedicine.com. Happy to answer any questions that you have. I will make sure that I get this recording out to everybody who registered. We had about 50 people registered for this webinar today, which is amazing. We appreciate all of you so much. Thank you for your support. Thank you for being here. It's always so much more fun to do these webinars live for people, and the interaction is appreciated as well. So if you're interested in having a deeper conversation, you're not a current client, you haven't chatted with us yet, please log on to our website, valleyvitalmedicine.com. There's an opportunity there to register for a discovery call. Otherwise, If you are a current client, you want to know more about ozone therapy, you can send me a message in the portal, or you can just set up a 30-minute consultation with me, and we'll talk through the potential benefits for you and make sure that we set you up with a plan that's right for you. So thank you so much, everybody. Have a blessed day, and we appreciate you.